Chair Nelson and members of the board, departmental item number 1 is from the County Executive Office. It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019, COVID-19.
Welcome, Dr. Del Reynoso.
Good morning, Chair Nelson and members of the board. Madam Clerk, may I have my slides? Next. This morning's briefing will go over the COVID-19 dashboard, give your board an update on the booster conversation, update on our testing capacity, as well as giving your board an update on our flu season. Next. From our dashboard, as of September 20th, we have 76 new cases, and this is a decrease from the 2-week average of 105. We have 473 active cases, and this is also a decrease from a 2-week average of 554. That brings our total cases to 41,402. Our testing, our case rate per 100,000 as of September 16th is at 16, with a testing positivity at 4.2. Unfortunately, we reported 3 new deaths. These are 2 individuals, 50 to 69 years of age, and 1 individual in the 70+ year of age range. The individuals resided in Orchid and Santa Maria. We currently have 45 individuals hospitalized, with 12 in the ICU. Our total death is at 497. Next. This is our case rate over the spans of the pandemic. We are currently reporting our case rate at 16. So that is a decrease of roughly 35% over the last 2 weeks. Next. This is comparing case rate by vaccination rate as of September 9th. The top line, the red line, describes the trend for unvaccinated individuals, and the case rate is at 30. Our county-wide rate is the middle line, the gray line, so it is at 17.2. The lowest line, the blue line, is for vaccinated individuals at 6.2. So as of 9/9, cases were 4.8 times more likely to be unvaccinated than vaccinated. Next. I'd like to share with your board, this is a, sometimes it's always good to compare our case rate with at the state level and at the national level. So the blue line describes, and this is case rate per 100,000 per day with a 7-day average with no lag. And so the top line, the blue line, is the national rate at a case rate of 42.79. And California is described by the orange line with the case rate at 14.56. Our county, Santa Barbara, is described by the green line. And again, our case rate is at 16.68. So this is really a good depiction of what's happening around us. And just if you are interested, SLO case rate is at 27 and Ventura is at 15. Next. This slide describes our hospital capacity as of September 19th. We have 63.2% of our hospital beds in use, and we have 70.1% of our staffed ICU beds in use. So our hospital capacity has slightly improved this week, but we are still very close to the red zone. Next. Our vaccination rate as of September 19th, we have 67.4% of eligible Santa Barbara County residents as fully vaccinated. And again, it's still roughly 1 in 3 eligible persons in Santa Barbara County is still unvaccinated. Next. We continue to see modest increases at the zip code level, and vaccination level by zip code is available on a daily basis on our public health sbc.org under the vaccination tab. And you can hover over a particular zip code and see and track the changes in those particular zip codes. Next. So from the previous slide, this is the highlight. We are distilling key takeaways. The greatest percent increase from previous week were observed in the following zip codes: in the Los Alamos, the Santa Maria, Casmalia, Antonio, the Guadalupe, Santa Maria, Sisquoc, and Gary, and lastly, the Lompoc, Vandenberg Village, Mission Hills, Concepcion, and Acorn. We are seeing more than what we were anticipating. And so this really, again, is a combination of continued effort and outreach with our partners in these particular zip codes, as well as the availability of the mobile vaccination clinic, as well as community members being ready to be vaccinated. Next. Current outbreaks, we are reporting 58 active outbreaks, with 9 among businesses, 28 among schools, and 21 among congregate living facilities. Next. With regards to the Pfizer booster shot, the last Friday, the FDA advisory panel voted to recommend the Pfizer booster shot for 65 years and older, or those at high risk of severe COVID-19. The panel also supported authorization. So this is not a vote. They supported authorization for healthcare workers and others at high risk of occupational coronavirus exposure. So booster programs cannot begin at the local level or at the state level until the FDA has made their formal approval and CDC issued the clinical guidance. Next. I'm just wanting to share with your board that we continue to prioritize preserving our testing capacity in our county. And so what this means is that we continue to work with employers so that they can have a direct contract with the state for free employer-based testing. We continue to support our Goleta Valley Community Center, our Buellton Community Center testing, Santa Maria Fair Park testing, as well as supporting our 2 testing sites based out of our healthcare center in Santa Barbara and in Lompoc. Next. We are happy to announce finally that we are adding to our testing capacity. So it is confirmed that the minibus will be coming next Monday on September 27th. It will be parked at Direct Relief in Goleta. The capacity is 168 tests per day. It will be open from 9 to 5 Monday through Friday. Appointments can be booked at our website, publichealthsbc.org/testing, or walk-ins are accepted as long as there is space available. Next. Well, it is once upon us again, the flu season. The Santa Barbara County Public Health Department wants to remind your board and our community that the flu season has arrived. Flu vaccination will be very important, especially because we are still in a pandemic, to reduce flu and to reduce the overall impact of respiratory illnesses on our community. Getting the flu vaccine is an essential part of protecting our health and our family's health. Flu vaccination reduces the risk of flu illness, hospitalization, and death, in addition to other important benefits. The CDC continues to emphasize the importance of flu vaccination beginning September and for the entire flu season. Flu activity can peak in the coming months, in particular in December through February, and can last until May 1st. It takes about 2 weeks after vaccination to develop antibodies that provide protection against flu. So the best action is to be flu vaccinated before the flu virus begins to circulate in our community. And we have listed places where individuals can get vaccinated. It is so convenient. The flu vaccine is available from your regular healthcare provider as well as retail pharmacies. And in addition, many employers like our county, schools, colleges, universities also offer them. And if individuals don't have a doctor that they regularly see, and flu vaccines will also be made available through our local health department and our vaccine clinics. And there are pictures from previous years where your board participated in our flu season kickoff by getting vaccinated. Next. I'd like to end my briefing by sharing with your board an example of our outreach. This particular effort focuses on the facts about COVID-19 vaccines. This graphic is available in both English and Spanish and will be shared widely through our platforms and our partners. And it really just addresses some of the facts that we want to make sure that everyone is aware, that researchers took no safety shortcuts. Large studies show that the vaccine is safe. Another fact, that the vaccine helps your body produce antibodies, but cannot change your DNA. Another fact, the vaccine cannot give you COVID-19 because it does not contain a live virus strain. Fact, it does not have egg proteins and can be given to people with egg allergies. Fact, the vaccine can cause mild side effects that resolved in a few days. And lastly, fact, there is no evidence that the vaccine causes infertility. So with that, my briefing ends.
Thank you, Dr. Dovernoso. Questions from the board?
Yes, Mr. Chair.
Supervisor Hart.
Yeah, I just had a question for Dr. Dovernoso about the flu vaccine. Are you planning to come back to the board to give us our shots at a future board meeting?
Yes, our team is ready and available to join me at our next board update in October. So we will be there with flu vaccines for any board members or those in attendance who wish to get a flu vaccine.
Thank you very much for that opportunity.
And I'm going to remind everyone to wear short sleeve shirts.
Thank you, Supervisor Hart. Any other questions from the board? Right, I had a quick question about, there was a lot of talk last year about the flu season and having a very low presence of flu in the community. And, I'm looking on the dashboard, it seems that is also true. What is the expectation, understanding this last year and what we're looking at moving forward?
Right. Great question, Chair Nelson. So what we experienced last year was very unique in that we were still, there wasn't a lot of mobility in the community. We were still under quite a few restrictions. Everyone was masking, social distancing, and really limiting their outings and their gatherings. So that on top of the flu vaccine really precipitated us in a good space where we did not see a lot of flu infections and flu deaths in our community and in other communities as well. This year is a little bit different. We, for the most part, have resumed normalcy. There is no restriction on gathering, social distancing, and people have resumed for the most part their normal, typical activities. So we want to make sure that everyone will continue those precautions as well as take the flu vaccine so that we can keep flu circulating at a very minimal level.
Thank you. Have we had any positive flu cases in the county?
And
Today?
not that I am aware of.
Okay, thank you. All right. I also had some questions for HR on the testing and vaccine policy. I understand that I've got a lot of questions from various employees in the county over the last couple of weeks on the progress, and I think HR has a slide that they can provide for the public and for our employees.
Good morning, Chair Nelson and members of the board. This is Maria Elena, the county's HR director. And I actually have for you a presentation, more of an update in terms of where we are with the policy, the county employee vaccination verification and testing policy, as well as specifically the question that you had for us, which is on the exemptions. So that's what I'll cover today. With me for today's update is Joe Pisano, our Division Chief for Employee Relations, Carlos Silvas, Employee Relations Manager, and Victoria Tuttle from County Council. And so the next slide, please. So here we have, this is specifically the question that you had for us on the exemptions. So it can get a little complicated and can be confusing. At the end of the summer in July, we had the state health order start. We received the beginning of 3 state health orders at the end of July, and into August, there were a total of 3 state health orders. And basically those state health orders were for a very specific group of our county employees. And it was pretty much a vaccination mandate that for our public health, our PUF clinics and Be Well, specific employees in our correctional detention and Santa Maria Juvenile Hall and Los Prietos Boys Camp. And it's a vaccination mandate that said that you had to have your vaccination, and if not, you could have exemptions, and there were only 2 exemptions based on medical or religious reasons. And in order to get those exemptions, we identified a declination form, and through that declination form, you'd still need to go through weekly testing. So it was a very specific group of our employees. It was not the whole county, it was just these specific groups. And it was a mandate for vaccines. And the exemptions for those are just these 2, medical and religious. And the form for that is through this declination form. And then it was weekly testing. So that was a very specific group. And there are, the deadline for that, for those are coming up September 30th for most of the clinical groups. And then for the correctional and detention, that's they have until October 14th to ensure that we meet those mandates. So then at the end of the summer in August, a couple of weeks ago, right, August 27th, our county board approved the county's employee vaccination verification or testing policy. So it was not a vaccine mandate, but employees had to verify to us that they had their vaccines, or if they didn't want to show us any kind of documentation, they could choose to go through a weekly testing process. And so exemptions are really not necessary since we're not mandating the vaccine. And again, there's no necessary exemptions for testing, except for we are creating a form that if our employees are not comfortable with the PCR testing, that we will consider an alternative for that PCR testing, but it is not an alternative for the testing itself. Our employees still have to have some kind of testing on a weekly basis because that is the policy. You show documentation or you go to weekly testing. So the PCR can, if you don't want to do the PCR testing, we can look at an alternative type of testing. And we are still developing that form, and we hope to have that before the deadline of September 30th or soon thereafter. So those are the two different policies, the mandate from the state health order, and then the county's policy for the rest of the workforce that did not fall under the state health order. Then we had our own local health officer order that has been in place for the overall county around face masks that went into effect and will be expiring on October 5th around face masks, that all of our employees need to be wearing face masks while indoors performing their work in buildings, county buildings. The exemptions are if our employees are working alone in an enclosed office with a door without any other employees in that office, or when they are actively eating or drinking. And if there are issues for our employees with the face mask requirement, our employees can file through or request through Title VII or the ADA accommodations process. And there are protocols for that our employees can follow to request those accommodations. So since August 27th, we have been fielding numerous questions from both our union leadership and our department managers and department directors. And we are answering those questions, and we are posting those on our HR intranet, as well as the forms. The declination form is there, and that's our link there. And when we finalize the request for alternate COVID-19 testing, that form will also be there. We will continue to meet with our department representatives as well as our union representatives. And so if our employees have any questions, really the best approach is to for the employees to meet with their supervisors and managers, the HR rep at the department level, union leadership, because our ER teams have continued to meet with them. And then of course, county HR. The HR internet site is going to be a good place for them to get information and answers to their questions. So that's our, in terms of the policy distinction, because it can get a little confusing. I thought it'd be helpful for us to take a look at our numbers in terms of who does this policy impact. So the next slide, please. So here's where we stand as of yesterday. The numbers have adjusted a little bit from the last time I presented the numbers, and that's only because our elections workers are no longer with us. Several of our seasonal workers are no longer with us. So the total county workforce has decreased, and that overall helps the testing numbers. So now we are at 72% vaxxed and verified. as compared to, we were at the end of August, we were at 49.3% vaccine verified, and now we're at 72. And so currently we're at 28% if we were to look at our testing population. If we say those that are vaccine verified, or the rest will be considered our testing population. However, the deadline for our departments was last Friday to get us these numbers, but we're still processing a few more departments. We have 3 or 4 that are still trying to collect those numbers. So we think that these numbers will shift. Included in the 28% are also those that employees have the first shot, but they don't yet have the second shot. And as you know, the definition of fully vaccinated is when they have completed the 2 shots and are beyond the second shot. So those individuals are still not considered fully vaxxed. And so they're kind of still in that 28%. So the numbers will adjust a little bit as we head into the 9/30 deadline date. But we're looking much better than we were in August. And so these numbers will continue to adjust. So as we look at right now, the 28%, let's take a look at the next slide that will tell us what our testing process is going to be for this 28%. Next slide, please. So here's our testing implementation update for you. So based on what our departments were saying to us in terms of operational needs, we've identified locations where we will have the testing done. We're looking at the Santa Barbara Administrative Building location, since that's a great number of employees, a pod of employees. We're looking at Santa Maria, Calle Real, and then we have department specific that based on operations and total numbers, the fire, sheriff, public health, public works, and social services are departments that will most likely run their own testing locally, as that will help them operationally. And we've have asterisks on all of this because locations and times need to be determined based on the actual numbers of employees that need to be tested. And we are still processing that. We are happy to report that we have contracted with Color Platform and the Valencia Laboratory as our vendors for the dashboards. That's where we will manage the results of the testing. Valencia Laboratory will provide us the drop boxes in the Santa Maria area and the Santa Barbara area, and they will test our specimens. We have made the decision to hire medical assistants for our county locations, and this will help in ensuring that we have observers and record keepers for this process. They will deliver to the drop boxes. They will be trained and have the appropriate protective equipment that they will need, so that managers and supervisors aren't the ones that are actually doing the observing. If you recall, the test is a self-test, but someone still needs to observe and record and make sure that the test kits are handed out appropriately and the employees are instructed correctly, and that the record keeping and all of that is done adequately. And so here's the implementation. We need to order the kits, and you've heard on the news that there's a bit of a backlog with the kits because all employers are having to go through this. The county is not the only employer. And so Color Platform is not allowing us to just throw a number out there for the total number of kits that we can order. They really want us to be very diligent and specific in terms of the total kits we can order. And so having that number nailed down is really important. And so once we have that, we can order, and then employees can register onto the Color Platform site. Employees will get their emails so that they'll know when to go. Weekly appointments will begin. Then the dashboards can start getting managed. And then should there be a positive, we already have the protocols through the Cal OSHA standards as to what management is informed as to what we need to do and follow should there be a positive result. So that's our process right now. But, you know, the ground is always moving, and we've got a good team in place with partnerships with county council and my employee relations team, that we've been pretty agile in adjusting and adapting as we need to, always in communication with the unions. They've been good partners as well. And our job is to make sure that we keep the lines of communication open. And we need to adjust as we need to when we get more information. But so far, that's the game plan. And I'm available for the next slide and to answer your questions if you have any questions for me.
Thank you, Ms. De Guevara. Any questions from the board? Supervisor Lavanino?
Thank you, Mr. Chair. So even though we're at 72%, that still leaves a little over 1,200 employees. It looks like that we're talking about testing. So curious, out of that 72, I mean, up and above the 72%, do we have any idea how many have already taken one shot so that they're on the path to getting out of our testing?
Yes, the number is somewhat small. It's not going to make a big dent right now from what we've looked at.
Okay.
Again, we still have 4 departments, and one of them is a pretty big one. So I'll
Okay,
know
and then-
more later.
Yeah. And then I don't know if this is for Dr. Reynoso or not, but is it proper to be getting tested while you're in the protocol of getting your shot? So what I'm saying is, like, the people that are getting their shots, they're still, from what I'm understanding, we're still going to require them to be tested until they're 2 weeks past their second shot. So does it make sense to test people as they're in that protocol?
That's a great question, and I don't have an answer to that, but I will check with my team for a response right now.
Thank you. Any other questions from the board? I've got a couple questions for Ms. De Guevara. If you can go back to slide, I think it's slide 2. So that first column there, the state health officer order requirement, and do we have any idea of how many employees fit into that?
Let's see. I don't have that right offhand. Carlos, or do you happen to have that?
No, we don't actually have that number.
Okay. Because I guess I was kind of concerned because I think there's been some confusion out there on which column some of our employees fall into. I've heard from people outside of those departments being asked to fill out the medical and religious exemption piece, which don't seem to fall under that state health officer order. So I think maybe some clarification might be helpful for our employees so they know where they're at with that. My other question is with the medical and religious exemption. What is our certification process on that? Are we accepting self-certification of a medical or religious exemption?
For the medical exemptions, we are requiring a physician's note or verification of such, and we go through that accommodation process for that. And for religious exemptions under the state health officer order, it's simply a completion of the declination form claiming a religious exemption.
Okay, so no further verification beyond that.
Not at this time.
Okay, thank you. All right, that answers my questions. Supervisor Lavanino?
Well, I think that brought up another question, kind of putting those two together for me. And I guess we don't have the information, but something I'd like to see is out of that 1,200 employees that we have, how many of them actually fall into the first bucket that are required by the state? So that way that kind of limits us knowing how many we're going to have to test. So I'd just like that information later. Thank you.
All right.
Okay.
Thank you. I think at this time we'll go to members of the public that are available for